Our Health Matters series concludes this morning with our final segment about the important work being done at inpatient rehabilitation hospitals. And I'm happy to say that I'm on location once again at HealthSouth, one of the premier inpatient rehabilitation hospitals in the country with over 100 hospitals nationwide. And I'm joined once again by Dr. Dexanne Clohan, HealthSouth's Chief Medical Officer, and Cheryl Miller, National Director of Therapy Operations. Ladies, I want to thank you again for partnering with us on these great segments. And this is our final one. And Dr. Clohan, let's recap a little bit about what you do here at HealthSouth.
Well, HealthSouth is a system of rehabilitation hospitals. So people who have found themselves either by injury or illness losing function, unable to do the things they need to do in their life, mobility, speaking, thinking, whatever it is, can find themselves being at an advantage to come to a place where they get a higher level of care, where the therapy is very intense, the medical care is very close.
And doctor, the last time we were here, we talked a little bit about some of the conditions you treat. Let's talk more about this.
We treat a whole range of conditions. The ones that come frequently to people's minds when they think about a rehabilitation hospital are conditions like stroke, spinal cord injury, brain injury, amputation, very dramatic, sudden types of loss of function. But we also take care of patients who've had complicated cardiac conditions, complicated lung situations, whole body infections, multiple trauma. A whole range of people can benefit from rehabilitation hospital services.
Dr. Miller, that's a pretty comprehensive list. Let's talk about someone, let's say, for example, who has a hip fracture. What kind of rehabilitation would they expect?
Well, we often see patients with hip fractures in our hospitals, and the first thing we're concerned with, of course, is their medical stability or their medical management. So our certified rehabilitation nurses will work with the patient to make sure that they're medically stable. They're getting the medication. They often will need a pain medication because of the injury. They may need some wound care because of the wound or if they had surgery. Then we move on to the therapy part of it, and we're concerned with their mobility after the hip fracture. We're also concerned about their ability to take care of themselves, dress themselves, bathe themselves, feed themselves, anything that's interfering with their simple self-care. The final thing I think that's very important to us is the education that they're going to need to return home safely. So it's very common, actually 1/3 of all elderly adults over the age of 65 will fall every year. And most of our hip fractures are due to falls. So we must continue to provide them really good education about how they can prevent or reduce falls at home. And sometimes that's as simple as having a nightlight in the home, watching your pets, picking up carpets off the floor. We have to make sure that they're safe to go home because we don't want them coming back to HealthSouth with another injury because they fell at home. Strokes are another common diagnosis we see in our hospitals, and there are some commonalities between the hip fractures. We're concerned with their medical management, their mobility, their self-care. But I think the thing that makes it more complicated for us to treat the stroke patients is the injury to the brain.
Sure.
So with the brain injury, we may see things like difficulty communicating, speaking. They may have difficulty thinking with their cognitive skills, memory, problem solving, reasoning that we do every day. And finally, they may have some difficulty swallowing because of the injury to the brain. So then they may require what we call speech therapy. So speech language pathologists would treat our patients that have strokes pretty often.
Dr. Clohan, before you send somebody home, let's talk about what you look for in terms of progress.
The key is to have them be safe and ready to continue their improvement after they're out of the hospital. So at the very beginning, when they arrive, with the physician's supervision and direction, game plan is really established. So we work with the patient and their family to decide what their goals are, what they need to do to be able to go home safely. So we try to take care of all of their medical needs, all their therapy needs, nursing needs, and send them home with the team sending them off and cheering.
This has been such a great partnership. I've been through it and I've seen it, and you guys are moving mountains here. Fulfilling, doctor?
This is absolutely the best practice of medicine, the specialty of physical medicine and rehabilitation, and HealthSouth provides a setting where that can be done with the patient right at the center.
Dr. Miller?
I think most of us look our whole lives for a career where we can make an impact with people, change lives, and at HealthSouth we're able to do that every day.
And they're very fortunate to have you two and
Thank you so
everybody
much,
else
Olga.
here.
Thank you.
God bless your entire team and HealthSouth. Thank you so much. And for viewers who maybe are looking to put someone in a place like this, where can they go, doctor?
HealthSouth.com, or ask your doctor or discharge planner in an acute care hospital about a rehabilitation hospital. Make sure to use the word hospital. You'll get a higher level of care.
And I've learned right now the difference. Thank you so much, ladies. God bless both of you. And for more information on HealthSouth and any of these segments that we've done, just go to our website. That's thebalancingact.com, thebalancingact.com, and always join us on Facebook and Twitter. We always love hearing from you.